Okay.
For aging, there was a traditional dedication of the parking tax, a portion of the parking tax for senior services.
Really?
I'm not sure where that came from, but there was a lawsuit and that's actually been replaced. But for public health, it's primarily property taxes.
Okay.
That's where most of the local funding comes from.
And you were discussing a little bit earlier in the prior segment some of the challenges, unique challenges perhaps that may be faced in San Francisco because we have such an unusual population in many ways. I'm curious though, is the population here any older or younger? We talked a little bit about how California sort of mirrors the country. I'm curious about our own city and county.
San Francisco actually has, and the Bay Area I think in general, has a larger older adult population than the rest of the state and country, or at least it's higher here. One of the things that we've also noticed in the Bay Area is that we have a lot more people who are in that 85 plus age range. And so one of the issues that comes up in that group is that 1 out of 2 85-year-olds and over have dementia. Okay. So that creates other difficulties that need to be addressed, obviously. But it is true that we have a higher percentage generally of older adults than others around us.
To springboard off what she said, also in the population that I work with at the Lighthouse for the Blind, people over 75 years old, 1 in 4 have vision loss. So we're working with a group of people who have had sight their entire lives, as they age are losing their vision and haven't come through the rehabilitation system. Sure. So for them it's a whole new thing to deal with, and their biggest asset may be a house that's from the furthest point of public transit that you can get and still live in the city. I mean, it creates a set of problems that you didn't envision as part of a good quality retirement.
Right. And how was the Commission on Aging responding to these kinds of, what I would call unexpected, or not unexpected from your perspective, but perhaps not obvious to the lay population of San Francisco, that Jim, you mentioned, has been very supportive historically of services for the aging, but perhaps people don't realize some of the unique needs that are out there. I mean, how does the Commission on Aging, do they have to, does one program get more and unfortunately one gets cut, or I know we try to fund everything, but how are those just tough decisions made?
Sometimes it's just as you said. It's having to evaluate if you don't have enough dollars, how do you spend those dollars? And one of the things the Department on Aging is looking to do soon is to do a complete needs assessment so that we at least can do this from some educated perspective, but I can tell you everybody that comes in front of us has a need. And it's really a difficult decision to make about who to fund and who not to.
Jim, what do you think people can do, let's say the families who have an aging parent or parents, or those who are simply advocates for the aging, what can be done at a local level to increase the visibility of the kinds of programs we've talked about, or to make sure that the historic support for these programs continues and perhaps expands? Are there some kind of grassroots or efforts that people can make in that respect?
There are a lot of advocacy groups, but I think the most important thing is for people to get the attitude that they can be supported in their homes. Because the whole point is to age in place. And unfortunately in the past, I think we've looked to institutions as the answers to that. And in San Francisco, we have the largest publicly owned skilled nursing facility in the country at Laguna Honda Hospital.
Right.
And we're struggling to try to get the money into the community, like into the public authority, into community-based services, so that people can stay in their homes as long as possible. And so if family members have a senior that they're concerned about, they should get online, first of all, and look at what's available. And the Department of Aging has a wonderful website that's available for anyone to access, the Community of Support.
Yep.
Communityofsupport.org. And it's easy to look up whatever you need, whether it's home delivered meals or congregate meals, transportation, in-home support.
What is the main ingredient, if you will, of home support? Is it having someone who trained or paid by the city to come in for a certain number of hours to help out with someone? Is that a key, or are there other kinds of resources short of that seniors or their families can take advantage of to keep to keep someone in their home?
Well, and actually this goes back to a question you were asking earlier about what's changing around us. And one of the largest programs that's within our department is a program called IHSS, In-Home Supportive Services. And based on your income, you may receive that program without any charge, and that would in fact provide you with both personal care or shopping or any of the number of the I mean, I think about this often. In the morning we kind of take for granted that we get out of the bed, we brush our teeth, we go into the shower, we use the commode, we do all, and we run down the stairs. I don't know about you, but to get my first cup of coffee, and it's back upstairs to take my medicines for the day. If you can't do those things, in-home supportive services is a program that is possibly for you. One of the challenges in our community, and actually this is a challenge across the country, is that as people are living longer, their retirements are not sustaining them for as long a periods of time, and so they may not qualify for a program like IHSS, and they may need those same services. They may need to buy that privately, and as they're living longer, their funds are not lasting as long, and so that's of course where family and friends and loved ones.
I believe I was reading an article saying that the longevity at some point may reach 100 or something like that, and obviously it sounds great at first blush, and then you realize that it raises a whole host of complications, like Anita alluded to, with vision, with hearing, with all kinds of issues with aging that can require one to need a step up in care and some help. And we'll return after a short break and continue our conversation with our guests. Welcome back to the Better Care Forum discussion on aging. We still have Jim Illig with us, and he is joined by Donna Kalame, Executive Director of the San Francisco IHSS Public Authority. Welcome, Donna.
Glad to be here.
And by Meg Cooch, Executive Director for Planning for Elders in the Central City. Thanks for joining us.
Thank you.
And we have been discussing issues of aging throughout the country, but specifically, mainly in San Francisco. And I know, Donna, that your organization has come up with some innovative ideas that may help to, alleviate the burdens of aging as our population gets up there in age. And I was hoping you might be able to tell us a little bit about that.
Well, the Public Authority does serve any age group that needs assistance to stay in their homes.
Mm-hmm.
So we do serve both aging and disabled populations and children and so on.
Mm-hmm.
And they are allowed to, if they want, to hire people that they know. If not, my agency, one of the main services that we provide is matching a home care worker who could provide the kinds of tasks that someone needs. And I should say that this is a publicly funded program, so it unfortunately is not available for everyone. But over 16,000 people in San Francisco do receive these services and are eligible for the program, and they're served by about 14,000 workers. So it has a very high impact in our population.
That's fantastic.
People who live here.
Yeah.
But it allows people to stay in their homes, and they can receive meals from other sources that might keep them at home, go to adult day health care, get transportation around the city, all kind of support needs that people need. The IHSS doesn't itself provide all those, but we can link people to those services, and that's the kind of service that can keep people in their home longer.
That's great. And Meg, I know that your organization has some interesting ideas.
Well, one of the issues is a lot of people, as they age in San Francisco has an unusually high number of seniors that live by themselves, so that's why IHSS is such a critical program. And so the city, state, and federal government partly pay for in-home supportive services, but Medicaid, which is the program that funds IHSS, tends to be biased towards funding towards institutional care because it's been slow to change over time. And so we're trying to advocate for a community living trust fund on the local level, which would be funded through local money, that would help kind of wrap around services, fill in the gaps where the state and federal and city money and services aren't available. So some people say IHSS requires people to pay a share of cost if they make too much money, and this community living trust fund could be drawn down. You could draw down money in order to pay someone's share of cost or help put grab bars in a house. A full range of services that would help people either avoid institutionalization or allow them to come out of an institution.
Now, is the Living Trust Fund up and running, or are we still in planning stages? I guess.
It's farther than planning in that there's actually a hearing tomorrow night that we're going to be trying to to have get a part of the $137 million surplus from this year and have that be allocated towards seed money for this. Ideally, it would be a larger fund with a lot more money in it where you could draw down the interest and keep kind of an endowment of sorts in place and draw down interest per year. But right now, I think, especially if we could get some seed money, then we could at least serve a couple hundred people over a number of years to show that it's working and kind of work out the structure of it.
Have other communities contacted you to try and emulate the same kind of programs, or are you so far kind of still on your own implementing the new kind of idea?
The trust fund is still definitely a very new idea. I mean, I think there are communities that are trying to strategize on a local level about how to do innovative programs and keep people in the community because of this issue of Medicaid not funding, housing and things like that in home, but they'll fund nursing homes, which is inherently housing. And so we definitely have created, through a lot of different advocacy organizations, created things such as a share of cost to help, pilot program to help people pay their share of cost and things like that to try to keep people in the community, and people, not just people that are the really low income, but also try to address the what some people call the upper poor, people that are kind of in that gap area.
Sure, because it sounds like there's an attempt to strive toward giving the aging population, like everyone else, some sense of autonomy and freedom to choose. Perhaps, you said, for example, grab bars in the bathroom, maybe all that someone needs, but someone else, that's not what their neighbor needs. Their neighbor needs someone to come cook a meal or 2 meals a day or something of that nature. And Jim, I know you had mentioned that there may be some changes now in policy on a national level to make that a little bit of an easier program.
Congress just passed a bill that they call the Money Follows the People Act, which allows for Medicaid to take that money that would normally pay for skilled nursing and put it into the community. And one of the most important things that we've already achieved, and Meg and Donna and all the advocates have really done a great job of getting this concept out there, getting, for example, the Health Commission that I'm a member of, to pass a resolution supporting it and deciding we need to find the funding for it. I mean, people forget that there are options in the community. The first and easiest solution is always lock somebody up in an institution.
Which I imagine is extremely expensive.
Very
and
expensive.
for the same resource could be devoted to allowing several people to live independently.
And especially because in San Francisco we realize we've got a growing population of vulnerable people. And they're vulnerable because of either disability or age or some other functional problem, and there are more and more of them, and they need to be supported in the community because that's where they live, that's where they deserve to be, because that's their right.
Meg, is the Community Living Trust based on another model, perhaps in another kind of service area that has been successful, or was it a dream? It was how did it come about to be put together as a potential solution to the problems here?
Well, actually, the controller, the city and county controller's office identified the concept of the Community Living Trust Fund with the idea that a larger amount of money could be placed in and then could be drawn down for this idea. I think the big issue here is an issue of choice. I think there's growing number of people, and ultimately people have the right to choose, and right now people don't have that right because a lot of times because there really aren't the comparable services in the community. So I think everyone, regardless of how you feel about nursing homes, believes that people should, if they can live in the community, should stay in the community. And so an idea like the Community Living Trust Fund and the money follows the person all goes back to the person and their personal choice about where they want to live and age.
Well, it sounds like progress is being made, at least kind of on a theoretical level. That's the model we should work toward. Do you think that's kind of a San Francisco, California West Coast thing, or is that, since Congress is doing something as well, it sounds like perhaps that model of allowing people to live in their homes is sort of capturing the imagination?
We're looking at that all over the country.
Yeah.
And of course, California is at the cutting edge in terms of public authorities for IHSS allowing people to have that choice. So we are starting things here, and we're hoping it's spreading.
Well, that's great. I mean, I really appreciate your guys coming. I think that what you're doing here in San Francisco is incredible. I think it's going to be a great model for the rest of the state and the rest of the country. And I really thank you for letting our audience know that these options are out there and that things are changing and they need to advocate for what sounds like very sensible and cost-effective solutions. So thank you for joining us. We're looking forward to having you with us in future episodes. Again, I want to thank our guests for coming and spending their time with us. And on behalf of the Better Care Forum, I want to thank our audience for staying with us, and I hope that they learned as much as I did today, which was really a great deal about aging and issues that are important to all of us.
Thank
So,
you.
yeah.